So here we are, just 2 days shy of the new year. And I don't know if you're someone who makes New Year's resolutions or not, but today, if you've been putting off your dental appointments for a while now because of the pandemic, I would encourage you to make 2022 your year to get your dental health back in tip-top shape. And I'll tell you why in today's short video. Well, hello again, folks, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the U.S. So you've heard me say in each and every one of my videos that I am retired from clinical dentistry, but I'm still very active in keeping up with the latest trends and technologies in the industry. And what I've been hearing from many of my colleagues who are still practicing is that patient visits to the dentist have dropped significantly. And it shows in the health of their patients' mouths. Some studies estimate that dental visits dropped as much as 79% during March and April of 2020. Now, obviously, that corresponds to when the pandemic was starting to really hit its stride here in the US, and the government was categorizing dentistry as non-essential, so I get it. There was nothing you could do. And now we find ourselves in the midst of the Omicron variant that is raging all around the world. So why would a trip to the dentist be on anyone's mind, right? Well, we know that poor oral health can negatively impact our immune system, something which we all need to be functioning properly, especially during this time. So we're sort of caught between a rock and a hard place, aren't we? Should we get back to our dentist and get our mouths back in shape, or keep riding it out to avoid any possibility of exposure until we get the all clear? Well, one reason to get yourself back in the schedule with your dentist is this. My colleagues have been reporting significant increases in gum disease, tooth decay, as well as tooth grinding in almost all of their patients, but especially in those patients whom they haven't seen in a while. And if you had COVID, then dental offices are reporting even more instances of loss of taste, dry mouth, as well as blistering and ulcerations in the mouth. Now, of course, this has been a stressful time for all of us, but the increase in tooth grinding has caused some of the most concern amongst dentists. This grinding has resulted in more cracked teeth and more chipped teeth. The cracked teeth sometimes need to be extracted and replaced with a dental implant, and those teeth that can be saved have needed crowns, onlays, or fillings to repair them. The longer you stay away from your dentist, the worse these problems get, and the more costly it is to fix these problems. So please don't wait, folks. Book that appointment. Now, for those of you concerned about the safety of the dental office and the possibility of exposure to the coronavirus, hey, that's valid. But let me just say that we in dentistry know all about infection control ever since the AIDS crisis back in the 80s. And I don't think you're going to find an environment more conscientious about sterility, disinfection, and safety outside of a hospital's operating room, perhaps. Dental offices operate under strict guidelines of universal precautions. That means treating each patient as if they could be potentially infectious. Everything that a patient comes in contact with either gets sterilized, disinfected, or disposed of after use. Many offices added HEPA filters to their HVAC systems that eliminate 99.99% of pathogens, and our existing high-speed suction units help contain any aerosols that might get released into the air before you can breathe them in. Here's the bottom line, ladies and gentlemen. Dental offices are the gold standard when it comes to infection control. We know what we're doing, and that keeps you safe. Folks, after a 2-year stint of lockdowns and good old cabin fever, we're all eager to get out and get back to a semblance of normal life as best we can. If you're not vaccinated, please consider doing so. If you are vaccinated, then get your booster. And folks, make a promise to yourself to call your dentist and get back on track in the new year. Not only is it safe to go back to the dental office, but ask yourself this question: is it safe not to? Well, let's wrap up today's video, folks. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Feel free to leave a comment or question as well. Please consider subscribing and be sure to hit that bell icon so you can be notified of future videos on dentistry made simple. Bye-bye.